Houston event last night, a documentary brought a spotlight on the rising costs of prescription drugs, insurance denials, and the human impact of healthcare and the system and how there are so many failures in it, but people are trying to change that. I am so honored to have the documentarian herself, Rachel Strauss, and a father of a 22-year-old son. His name was Cole, and this is Bill Schmitnick. I said it right, I practiced. But his son sadly suddenly died because he didn't have his asthma inhaler coverage, right? So first of all, both of you, thank you so much for being here.
Thank you so much for having us.
Well, this is important, and a lot of people are struggling when it comes to healthcare costs, and they shouldn't have to. So you ended up meeting Bill.
Yes.
And you connected, and you realized he had a story. How'd you find all this out?
Yeah, sure. So I've worked in healthcare for more than 20 years.
Yes.
I worked in a subset of the industry. Very few people know, but nearly 95% of Americans have touched it in some capacity,
Of course.
which has to do with pharmacy benefit managers. The acronym PBM, which again, many people don't know, is this middle layer of who is controlling what medication you have access to and how much you're going to pay for it if you have access to it. And it's typically not thought of. It's an afterthought with who your insurance is through. But really, it's employers, it's Houston employers, it's Texas employers and employers around the country who are really making decisions. And again, it's financial for their employees, right? Being that employers are the #1 way Americans have health insurance in this country.
And they're making life and death decisions on people.
That is correct.
Every single day.
And so when I set out with this documentary that I was approached to have an investor, producer role and really share my story, you know, it put me in touch with people who had been impacted in, unfortunately, the worst way possible as the system can fail.
And Bill, you were one of those with your son.
Yeah, yeah. My son, or our son Cole, passed away after not being able to get his Advair discus asthma medicine. It was a daily steroid. Been on it for 13 years. It was.
Why couldn't he get it? That's what people are trying to figure out right now. They're learning this.
Essentially, it was removed from the formulary. So you know, as the coverages change over the year and as we've learned things and as the rebates change or whatever, essentially it was moved from the formulary. It went to over $500, and he walked out of the pharmacy.
And this is what
he
couldn't afford it. And this is what so many Americans don't understand is, you know, you sit through open enrollment meetings. That's in the fall typically for most employers. It can happen at any time, and you hear your benefits haven't changed. But maybe something behind the scenes has changed. And a formulary, just to give a little glossary term here for people who may not know, right? A formulary is a list of medications that you are able to get under your plan design. Most Americans are familiar with the term copay.
Yes.
Because we go to the pharmacy, we hear we have tier 1, the cheapest copay, middle copay. But when a drug is completely removed from the formulary, it means your insurance coverage will no longer provide any copay for it.
So you have to pay for it
in a cash
out of your
price.
pockets.
And in Cole's unfortunate, you know, situation, he was told that his life-sustaining medication, something he had been on for his whole life nearly, was no longer covered. He was told a $500 price tag, which many Americans can afford that. And he just walked out. And where the system failed him is, #1, they didn't give him any alternatives. His physician was never reached out to. And truly, the pharmacy has a responsibility when somebody does not pick up a medication, if they hear it's financial, to help that patient and figure out how do we get you a drug that you need. Because in Cole's case, I mean, Bill, I'll let you share what happened.
Well, yeah, I mean, essentially, you know, he went to fill his, like you said, his Advair. And upon not getting it, it was a couple days later, he suffered a severe asthma attack, turned into cardiac arrest, and he ended up in the hospital. And he passed away on January 21st of 2024. And
he's 22 years old.
22 years old. And like I said, it's just sad because he was given a price tag to live, and he couldn't afford it. And
I'm so sorry. Let me ask you this though. With this documentary, you're bringing attention to something that millions of people are impacted with on a daily basis. What can we do to change it?
First off, Americans need to have an understanding that they have a right to fight and that there is so many opportunities out there. Last night, I had many sponsors who helped put on a nice event where people could learn about these stories. And fundraising was also done in partnership with Dallas-based nonprofit, the Marshall Allen Project.
Right.
The Marshall Allen Project offers a free AI tool where patients can go ask questions, tell it what's going on in your healthcare journey. If you have bills, if you have a prescription drug you can't access. That's what my company, PBM Princess, does, is we help individuals, primarily companies, when they're looking at, crazy increases. In Texas alone, in Houston alone, we are seeing for our employers 20–30% increases, record increases, a lot of which has to do with things you've probably talked about here at the CW39, GLP-1s. I saw earlier segment, menopause, which is something I definitely know a little something about in the perimenopause. We're allowed to talk about it now.
Yes,
we talked about it. We're normalizing that.
Yes.
But, it's all the things in access and Instagram and all of the things that Americans are learning about healthcare, they're using it.
What is your hope? Because I know we're running out of time.
Yes.
What is your hope by presenting this documentary, sharing your story, and also the website where people can get the information that you just talked about?
Hoping that employers will hear this, employees will hear this, and tell people that there are options out there.
Yes.
And to stop accepting status quo. Stop just taking, it's all expensive. It's too confusing. I was told no. Know that they can advocate. There are people, there's a whole world out there that are here to help Americans and, not just say the system is broken.
Fight for it.
And fix it.
And fix it. Where can they find the information?
Absolutely. My website, rachelmstrauss.com, and I'm happy to point you into any other area in my wheelhouse.
Rachel, Bill, thank you so much.
Thank
I
you.
know this is difficult, but you're going to, I think your son is going to be a catalyst for changing other people's lives to make sure what happened to him doesn't happen to others. And thank you for sharing that.
Thank you.
Because we need to change it so we can save more lives.
Absolutely.
You were both so strong. Thank you so much.
Thank you.
Thank you so much.